Internal carotid artery is the terminal branch of common carotid artery. It arises at the level of upper border of thyroid cartilage or at the level of C3-C4 cervical vertebrae, where the common carotid divides into external and internal carotid arteries. Internal carotid artery supplies brain and orbit region. It has no branches outside the skull. Here we will discuss about the origin of internal carotid artery. Arch of aorta on right side gives rise to brachiocephalic trunk and it divides into right subclavian and right common carotid artery. Common carotid artery at the level of upper border of thyroid cartilage or C3-C4 cervical vertebral level divides into external carotid and internal carotid arteries. On left side, arch of aorta directly gives rise to left subclavian and left common carotid arteries. Common carotid artery at the level of upper border of thyroid cartilage or C3-C4 cervical vertebral level divides into external carotid and internal carotid arteries. Coming to the segments of internal carotid artery. According to Boutelier classification, internal carotid artery is divided into 7 segments. It is based on angiographic and the histologic appearance of internal carotid artery, and this classification is mainly used by neurologists and neurosurgeons. So, internal carotid artery, it is divided into 7 segments. The first segment, it is the cervical segment. Then second one, petrous segment. Third one, lacerum segment. Fourth one, cavernous segment. Fifth one, clinoid segment. Sixth one, ophthalmic or supraclinoid segment. Seventh one, communicating or terminal segment. In this picture, you can see each segments that gives rise to many other branches. Let's discuss each segment in detail. C1 or cervical segment. It extends from the bifurcation of common carotid to carotid canal located anterior to the jugular foramen. It has superiorly internal jugular vein. Its lateral relation is vagus nerve and medially there is pharynx. At the base of skull, glossopharyngeal nerve, vagus nerve, accessory nerve, hypoglossal nerve that lies between internal jugular vein and internal carotid artery. Coming to C2 segment, that is the petrous segment, it extends from carotid canal to the foramen lacerum within petrous temporal bone. It is surrounded by extensive sympathetic plexus and it is separated from middle ear by thin plate. It has an ascending or vertical portion, genu or bent and horizontal portion. C2 segments has two branches, that is median artery and caroticotympanic artery. Median artery anastomosis with external carotid artery. Caroticotympanic artery that supplies the middle ear. Coming to C3 segment, it extends from petrous apex above foramen lacerum, curving upward towards cavernous sinus, covered by trigeminal ganglion. C4 segment, it passed from petrous apex to the dural ring of the anterior clinoid process surrounded by cavernous sinus. C5 segment, it is between proximal distal dural rings of cavernous sinus. C6 segment extends from distal dural ring at superior clinoid to just below posterior communicating artery origin. C7 segment extends from below posterior communicating artery to terminal internal carotid artery bifurcation into anterior and middle cerebral arteries. It passes between optic and oculomotor nerves. Let's discuss about the branches of internal carotid artery. Here you can see C1, C3, C5, that is odd numbered segments except C7 has no branches, but all even numbered segments have branches. C2 segment, that is petrous segment, it gives rise to two branches. First one, it is caroticotympanic artery. Second one, branches. First one, meningo-hypophyseal trunk. Second one, inferolateral trunk. Then C6 segment or the ophthalmic segment. It has two branches. First one, ophthalmic artery. Second one, superior hypophyseal artery. C7, that is communicating or the terminal segment. It has four branches. First one, posterior communicating artery. Second one, anterior choroidal artery. Third one, anterior cerebral artery. Fourth one, middle cerebral artery. To summarize, according to Bowthiler classification, internal carotid artery, it is divided into 7 segments. The first one, cervical segment. Second one, petrous segment. Third one, lacerum segment. Fourth one, cavernous segment. Fifth one, clinoid segment. Sixth one, ophthalmic or supraclinoid segment. Seventh one, that is communicating or terminal segment. Coming to the branches, C1 segment, no branches. C2 segments, 2 branches, caroticotympanic artery and artery of pterygoid canal. C3 segment, no branch. C4 segment, 2 branches, that is inferolateral trunk and hypophyseal trunk. Then C5 segment, no branches. C6 segment, 2 branches, ophthalmic artery and superior hypophyseal artery. C7 segment,